Boundaries in relationship. In a relationship, boundaries are limits that you set for yourself that help you feel comfortable and safe. They can be physical, emotional, or psychological, and they can help you to feel in control of your own life and well-being. Boundaries are important because they help to protect your time, energy, and personal space, and they can also help you to establish a sense of independence and autonomy within your relationship. Physical boundaries involve the use of your body, such as hugging, touching, and other physical forms of affection. Emotional boundaries involve your feelings and emotions, and how you communicate and share them with your partner. Psychological boundaries involve your thoughts, beliefs, and values, and how you express them within the relationship. Boundaries can be flexible and may change over time, depending on your needs and the needs of your relationship. It's important to communicate with your partner about your boundaries and to respect their boundaries as well. Setting and maintaining healthy boundaries can help to create a strong and healthy relationship. It's important to remember that boundaries are not meant to keep your partner out or to prevent intimacy. Instead, they are meant to help you feel safe and respected within the relationship. Boundaries can also help to create a sense of balance and fairness in the relationship, as each person's needs and desires are taken into consideration. Setting boundaries does not mean that you are being selfish or that you don't care about your partner. In fact, setting boundaries can help to strengthen your relationship, as it shows that you are able to assert your own needs and values and that you respect your partner enough to allow them to do the same. Boundaries can be difficult to set, especially if you have not had healthy boundaries in the past, or if you tend to be a people pleaser. It may be helpful to seek support from a therapist or a trusted friend or family member as you work on setting and maintaining healthy boundaries in your relationship. Few examples of boundaries that you might set in a relationship. Physical boundaries. You may set boundaries around physical affection, such as deciding that you are not comfortable with public displays of affection or deciding how much physical contact you are comfortable with. Emotional boundaries. You may set boundaries around how much you share your feelings and emotions with your partner, or how you expect your partner to respond to your emotions. Psychological boundaries. You may set boundaries around your personal thoughts and beliefs, such as deciding not to discuss certain topics or respecting each other's beliefs even if you disagree. Time and space boundaries. You may set boundaries around your need for personal space and alone time, or around how much time you spend together as a couple. Communication boundaries. You may set boundaries around how you communicate with each other, such as deciding to avoid certain types of communication, for example, shouting or name-calling, or agreeing to always be honest with each other. There are several factors that can indicate the need for boundaries in a relationship. 1. Lack of respect. If you or your partner are not showing respect for each other's boundaries or for each other's needs and wants, it may be time to set some boundaries. 2. Lack of balance. If you feel like you are constantly giving in to your partner's needs and not getting your own needs met, it may be time to set some boundaries to create a more balanced relationship. 3. Lack of personal space. If you feel like you are constantly together and never have any alone time, it may be time to set some boundaries around your need for personal space and alone time. 4. Lack of healthy communication. If you or your partner are not communicating effectively, it may be time to set some boundaries around how you communicate with each other. 5. Feelings of being overwhelmed or overwhelmed. If you are feeling overwhelmed or taken advantage of in the relationship, it may be time to set some boundaries to help you feel more in control. 6. Different needs. It's important to remember that everyone has different needs and boundaries, and what works for one person may not work for another. It's important to communicate with your partner about your boundaries and to be open to negotiating and adjusting your boundaries as needed. 7. Boundaries change. It's also important to remember that boundaries can change over time. As your relationship grows and evolves, your boundaries may change as well. It's important to be open to discussing and adjusting your boundaries as needed to ensure that they continue to work for both of you. 8. Boundaries are not a sign of weakness. Setting boundaries does not mean that you are weak or that you are not committed to your relationship. In fact, setting boundaries can help to strengthen your relationship, as it shows that you are able to assert your own needs and values and that you respect your partner enough to allow them to do the same. 9. Setting boundaries takes practice. Setting and maintaining boundaries can be challenging, especially if you have not had healthy boundaries in the past. It may take some time and practice to get comfortable with setting and maintaining boundaries in your relationship. 10. Boundaries are not set in stone. It's important to remember that boundaries are not set in stone and can be negotiated and adjusted as needed. If you or your partner feel like a boundary is not working, it's important to communicate about it and see if there is a way to adjust the boundary to better meet your needs. Different types of boundaries that you may set in a relationship. 1. Physical boundaries. These boundaries involve the use of your body and physical space. Examples of physical boundaries might include deciding not to hug or touch your partner if you are not comfortable with it. Setting limits on how much physical affection you are comfortable with in public. Deciding not to sleep in the same bed as your partner if you need your own space. Please subscribe our channel if you want to see video like this. Press the bell icon. 2. Emotional boundaries. These boundaries involve your feelings and emotions and how you share them with your partner. Examples of emotional boundaries might include deciding not to share certain feelings or emotions with your partner if you are not ready to. Setting limits on how much you are willing to talk about your feelings and emotions. Deciding not to share details about your past with your partner if you are not comfortable with it. 3. Psychological boundaries. These boundaries involve your thoughts, beliefs, and values and how you express them within the relationship. Examples of psychological boundaries might include deciding not to discuss certain topics if you are not comfortable with it. Setting limits on how much you are willing to compromise on your values and beliefs. Deciding to respect each other's beliefs and opinions even if you disagree. 4. Time and space boundaries. These boundaries involve your need for personal space and alone time. Examples of time and space boundaries might include setting limits on how much time you spend together as a couple. Deciding to have regular alone time or me time. Setting boundaries around your need for personal space, such as having a designated no-entry room in your home. 5. Communication boundaries. These boundaries involve how you communicate with each other. Examples of communication boundaries might include agreeing to always be honest with each other. Deciding not to use certain forms of communication, such as shouting or name-calling. Setting limits on how much you are willing to discuss certain topics. Some features of boundaries in a relationship. Clear. Boundaries should be clear and explicit so that both partners understand what is and is not acceptable. Respected. Boundaries should be respected by both partners. This means that if one partner sets a boundary, the other partner should not try to push or manipulate them into changing their mind. Negotiable. Boundaries are not set in stone and can be negotiated and adjusted as needed. It's important for both partners to be open to discussing and adjusting boundaries as needed to ensure that they are still meeting both partners' needs. Fair. Boundaries should be fair and take both partners' needs and desires into consideration. Healthy. Boundaries should be healthy and not harmful to either partner. They should not be used to control or manipulate the other partner. Consistent. Boundaries should be consistently enforced and respected by both partners. Communicated. Boundaries should be communicated openly and honestly between both partners. In conclusion, boundaries are an important part of any healthy relationship. They help to protect your time, energy, and personal space, and they can also help you to establish a sense of independence and autonomy within your relationship. Boundaries can be physical, emotional, or psychological, and they may change over time as your relationship grows and evolves. It's important to communicate with your partner about your boundaries and to respect their boundaries as well. Setting and maintaining healthy boundaries can help to create a strong and healthy relationship. Remember, boundaries are not meant to keep your partner out or to prevent intimacy. Instead, they are meant to help you feel safe and respected within the relationship.